Meet Elizabeth. She is a 36-year-old with a normal BMI who recently received her results for the oral glucose tolerance test. Based on the results, her doctor advised her to follow a no sugar, low carbohydrate diet and to keep her weight low for the remaining 8 weeks of her pregnancy. She delivered a large baby at 39 weeks. Based on the results of her oral glucose tolerance test, Elizabeth does have gestational diabetes. Her fasting sugar was within the limits, but both her 1 and 2 hour glucose plasma levels were too high. Elizabeth also gave birth to a large baby, which is common in women with GD. Pregnancy increases the mother's insulin resistance. Many women who end up with GD begin pregnancy being insulin resistant or being genetically predisposed to be insulin resistant. Since Elizabeth had gestational diabetes, she most likely was insulin resistant at the start. Most likely, Elizabeth's baby was large due to her uncontrolled diabetes for most of her pregnancy. Increased levels of glucose cause the fetus to create more insulin, which creates more glucose uptake by the fetus, resulting in a large baby. There are a few problems with the advice Elizabeth's doctor gave. In pregnancy, healthy sugars should be consumed as part of a well-balanced diet, especially sugars from fruits and dairy products, so a no-sugar diet is not necessary. According to the IOM, pregnant women need 175 grams of carbohydrates a day. Carbohydrates are necessary for fetal brain development, so a low-carbohydrate diet could be detrimental to the baby. Since Elizabeth began her pregnancy within the range of a normal BMI, she should plan to gain between 25 and 35 pounds. Depending on how her current weight gain is going, she may not need to keep her weight gain low. Furthermore, restricting calories during pregnancy can result in an elevation of blood ketones, which is related to a decreased mental development for the baby. Some appropriate dietary advice would be consume 3 meals and snacks daily, eat mostly whole grains, fruits, vegetables, and limit intake of sugar, eat foods with low glycemic indices and foods that are high in fiber.